Good morning, everyone. Before presenting our study, let me briefly introduce our clinical center and our clinical setting. We work at the endoscopy unit of Isola Tiberina Hospital, located in the very heart of Rome. Our hospital has a long-standing tradition in advanced digestive endoscopy and represents a referral center for complex and interventional procedures. I'm the head of the endoscopy unit and I work together with my colleague Salvatore, who is a consultant in our team. Our daily clinical practice is strongly focused on operative endoscopy, including advanced therapeutic procedures across different fields. In particular, over the past years, we have developed a growing expertise in bariatric endoscopy, offering minimally invasive solutions for the treatment of obesity. This includes endoscopic gastroplasty techniques, which are increasingly becoming an important alternative to surgery in selected patients. Today, we are presenting our study entitled Effects of Different Techniques of Endoscopic Gastroplasty on Weight Loss Among Patients with Obesity, a randomized single-center pragmatic trial. This work reflects our experience in this field and aims to provide a direct comparison between three different endoscopic approaches for the treatment of obesity.
So let's start from the broader context, because this study addresses a truly global issue. Obesity is now considered a pandemic affecting more than 600,000 million people worldwide, and it is associated with a wide range of complications, including cardiovascular disease, diabetes, and reduced quality of life. For this reason, it's essential to develop effective and sustainable treatment strategies. While lifestyle interventions remain fundamental, they are often insufficient in patients with established obesity. And this is where medical, surgical, and increasingly endoscopic approaches come into play.
Exactly. And in recent years, endoscopic bariatric therapies have gained significant attention because they offer a minimally invasive alternative to surgery. In this study, we focused on endoscopic gastroplasty, which aims to reduce gastric volume using endoscopic techniques without external incisions. Specifically, we compared three different approaches: endoscopic sleeve gastroplasty, or ESG, endoluminal vertical gastroplasty, or EVG, and the pose-2 technique. All three methods work by remodeling the stomach to induce early satiety and reduce food intake, but they differ in terms of devices, technical execution, and the procedural characteristics.
So what makes this study particularly relevant is its design. It's a randomized single-center pragmatic trial which ensures a good level of internal consistency and comparability between groups. A total of 184 patients were included with a mean body mass index of about 36.5, mostly in the range of class 1 and class 2 obesity. The primary endpoint was total body weight loss, while secondary outcomes included excess weight loss, safety, feasibility, metabolic parameters, and quality of life.
When we look at the results, the findings are quite compelling. At 6 months, patients achieved an average total body weight loss of about 15.5%, which remained around 14.5% at 12 months and increased to approximately 70% at 18 months follow-up. Similarly, excess weight loss was substantial across all time points. Most importantly, there were no statistically significant differences among the three techniques in terms of weight loss outcomes. This means that EVG, ESG, and pose-2 are essentially equivalent in efficiency over the medium term.
Another key point is safety and feasibility. All procedures were successfully completed with a technical success rate of 100%, and serious adverse events were very rare, occurring in only about 1% of cases. Although a large proportion of patients experienced mild symptoms such as pain, nausea, and vomiting in the immediate postoperative period, these were generally transient and manageable. This confirms that endoscopic gastroplasty is not effective only, but also safe in a real-world clinical setting.
Exactly, and beyond weight loss, we also observed important improvements in several clinical parameters. Body composition improved significantly. with a reduction in fat mass and an increase in fat-free mass. There were also positive effects on metabolic markers, including triglyceride levels and a reduction in hepatic steatosis. Equally important, patients reported a significant improvement in quality of life over the follow-up period, highlighting the broader impact of these procedures beyond simple weight reduction.
If we analyze the technical aspects more closely, some differences do emerge between the procedures. For example, EVG was associated with a longer procedure time, while post-2 resulted in a greater degree of gastric shortening. However, these greater anatomical modifications did not translate into superior clinical outcomes in terms of weight loss or quality of life. On the other hand, ESG showed a higher rate of minor technical issues during the procedure, while post-2 was associated with slightly higher rates of postoperative nausea and vomiting.
And these differences are important when considering clinical decision-making. There is no single best technique in absolute terms. Instead, the choice of procedure should be individualized based on patient characteristics, operator experience, and practical considerations such as procedure duration, tolerability, and resource availability. This reflects the broader shift toward personalized medicine in the management of obesity.
Of course, the study also has some limitations that we need to acknowledge. The most relevant one is the higher dropout rate during follow-up, with only about 15% of patients reaching the 18 months evaluation. This is a common issue in obesity studies and reflects the difficulty in maintaining long-term patient engagement. It also highlights the importance of continuous multidisciplinary support, including psychological follow-up, to sustain long-term outcomes.
Absolutely. Because obesity is a chronic disease and it requires long-term management rather than one-time intervention. Procedures like endoscopic gastroplasty can provide a strong initial boost in weight loss, but maintaining those results depend on patient adherence, lifestyle changes, and ongoing clinical support.
So in conclusion, the studies demonstrate that endoscopic gastroplasty, regardless of the specific technique used, is a safe, effective, and feasible option for treatment of obesity in the short and medium term. It offers a valuable alternative to surgery, especially for selected patients.
And perhaps the most important takeaway is that we now have multiple effective tools available. The challenge moving forward is not to identify a single superior technique, but to determine which approach is best suited for each individual patient. In other words, the future lies in choosing the right technique for the right patient at the right time. Thank you very much.
Thank you very much.